Assalamu alaikum, this is Dr. Hasna with Hasna's Nat. Today we're discussing the ear. And as we all know, the ear is divided into the external, middle and inner ear. But today we're going to be talking mostly about the external ear. So let's get started with the video. Do not forget to subscribe to my channel. Okay, so the first thing we're going to talk about is basically the two parts of the external ear. First is the auricle, which you can actually see on yourself, quite prominent. And the second part is known as the external acoustic meatus. Now, external acoustic meatus is this hole you see from which you can hear, all right? But here's that misconception that the external acoustic meatus is not just a hole, rather it's this whole tube-like structure that goes all the way up to the tympanic membrane. And we all know what tympanic membrane is. It is that boundary line connecting external ear to the middle ear. That boundary is made by the tympanic membrane. Let's talk about the auricle of the ear. What structures are forming it? The first thing we know is that this auricle is mostly formed by cartilage, right? And the cartilage, the skin around that cartilage is quite connected or very firmly adherent to the cartilage that is lying deep. This is why if there's any infection to the ear or any hair follicle infection within the external auditory meatus even, because that skin is so adherent to the cartilage, it causes severe pain in such tiny infections of the skin hair follicles. So let's talk about the structures making up the pinna or the auricle. The outer part is known as the helix. Now the helix, you can see where it forms the C over here. The C part of the helix is the crust of the helix, and the part lying within the helix is the antihelix. The hole over here is the external acoustic or auditory meatus. The area, that cartilage that is closing the hole when you have to shut off sounds of people talking to you, just close it. That thing you use to close, the curtain you use to close that external auditory meatus, this is known as a tragus. Since there is a tragus, there has to be an antitragus. For this area, this one that you can feel right here is known as the antitragus. Another important thing is that the helix goes down and this cartilage ends over here. Rather, this becomes a fibrofatty tissue. Now, this is known as the lobule of the auricle. This is where you wear those earrings. And this area that is leading to the external auditory meatus, this is known as the concha. So this was the basic structure of the auricle. Let's talk about the external auditory meatus. So the external auditory meatus is this tube that basically you can see it goes all the way till the tympanic membrane. Now, this whole tube consists of a lateral 1/3 and a medial 2/3. This whole tube is overall 24 millimeter in length, and the 8 millimeter lateral part is known as the outer cartilaginous part, whereas the medial 2/3 is 16 millimeter in length. Now, the interesting part is that the outer part is formed by the cartilage, whereas the inner part is formed by the bone. Which cartilage, which bone? So cartilage, we know, is the cartilage that was lining your auricle as well, is extending within inside, right? But what about the bone? What bone is surrounding your inner bony part or medial 2/3 of the external auditory canal? This bone is known as the tympanic plate of the temporal bone, which is posterosuperiorly deficient, where the squamous part of the temporal bone is making up for it. This canal is not just a very straightforward canal. I know it looks pretty simple, but to be honest, it's very complicated. It's actually an S-shaped canal, and that is because each of the part has different directions of running. It's not just straight. Rather, some runs up, some runs low, someone runs forward, someone runs backward. So how do we figure that out? So I have made this mnemonic that you should remember. It goes like UFM, UBM, DFM. When UFM, UBM, DFM is entered into the ATM, you get access to the UBL bank. All right, so basically we need access to the UBL bank ATM. So what you have to do is type the code UFM, UBM, DFM. Now, what I'm trying to say by that is divide this entire tube into a outer part, middle part, inner part. Now, the outer part is directed upwards, forwards, and medially. So I believe it would be medially. It's already going medially. We all know it's going towards the medial side. Now, how do we make it upwards? We make it a little bit going upwards. Is like that, going forwards. So you can say this is the external auditory meatus that we can see, and this is the canal, the outer part. You can see it's going forwards and then medially and a little bit upwards. Next part goes upwards, backwards, and medially, UBM. So upwards, backwards, and medially is somehow we have to form it like that. We take it upwards and backwards and medially, so that like that. And finally, the inner part says it goes downwards, forwards, and medially. So downwards, forwards, and medially. So something almost like that is how the auditory canal is shaped. First we have UFM going upwards, forwards and medially. Then we have UBM upwards, backwards and medially. So this is also going upwards, back. So this part is upwards and this part is downwards. So almost like that, you can say that the ear canal is not simple. It's S-shaped basically. Overall, if you can see, it actually becomes an S shape when we look at it from the above. The point of me telling you this has clinical significance in that when you have to examine the external ear by means of a torch or just looking at it as an ENT surgeon, what you have to do is UBL. You will retract the auricle upwards, backwards and laterally. You will be able to visualize the canal and the tympanic membrane that is lying at the end of this canal better. Why? Because obviously it's crooked shape, right? So we obviously have to apply a technique so somehow we can view inside. If it was so straightforward, all we had to do, you look inside through this, you can easily see that the tympanic membrane is visible. However, it's like all S-shaped and crooked, so you have to apply a strategy, and that is upwards, backwards and laterally. What happens is in the outer cartilaginous part, it is lined by skin mostly, just like the concha part. Similarly, outer 8 mm cartilaginous part of this tube is lined by skin that is adherent to the cartilage. And once again, here there's hair. If there's any infection, it's going to hurt a lot. And there are multiple wax glands over here. Now, wax glands are known as the ceruminous glands. Also, they are accompanied by the sebaceous gland to release some oil. Otherwise, wax would just be super solid. So we need something to lubricate that wax. The inner bony part, just 5 mm lateral to the tympanic membrane in the bony part, is your most narrowest part of the entire external auditory canal. This is known as the isthmus. Overall, the bony part is narrower than the cartilaginous part. Now let's talk about the nerve supply of the both parts. The auricle is supplied in its lateral upper part by the auriculotemporal nerve, whereas upper medial part is supplied by the lesser occipital nerve. The lower part is supplied by the great auricular nerve. The root of the auricle, this area right here, is supplied by the auricular branch of the vagus nerve. In the canal, the anterior half is supplied by the auriculotemporal nerve, whereas the posterior half is supplied by the auricular branch of the vagus nerve. So you can see almost the same nerves are existing in this entire area. And the importance of the nerve supply is that because there is an auricular branch of vagus over here, if there's any irritation in your ear due to wax or any procedure that is being performed, the auricular branch of the vagus can be triggered, and that can lead to ear cough. So you can cough because of it, and you can even have sudden death because we all know that the vagus carries parasympathetic fibers through the heart. It is cardio-inhibitory. The auricle is actually used in grafting procedures. Overall, the blood supply of this area is by the posterior auricular artery and the superficial temporal arteries. And the lymphatics, we all know the pre-auricular, post-auricular lymph nodes, and the cervical lymph nodes can also be used. With that comes the end of our topic of external ear. Really hope you understood well. See you in the next video where we will talk about the tympanic membrane. Thank you so much for watching.